It's my pleasure to introduce Professor Patty Kostkova from the University College London, who will be talking today about digital tools and social media experience from the COVID-19 pandemic.
So thank you so much for inviting me to join, albeit unfortunately virtually. I am chairing a digital public health conference in Portugal, in Madeira, which started today. So there has been a clash, and I was unable to be with you in person, unfortunately. But it is my real pleasure to be with you, albeit from Madeira, and be able to share some of our experience of how digital tools and social media were used during COVID. So I'm based at UCL, and I'm heading the UCL Digital Public Health and Emergencies Center, which looks into the use of digital technology and digital interventions to respond to pandemics, increase and strengthen preparedness and capacity, and respond to emergencies. Which until COVID, people didn't know what digital public health actually was. However, since COVID, one of the positive things from the pandemics is it became a kind of household term, and explaining to friends outside of my field what I do became much easier. DPH is working globally. Most of our work is based in low-income countries. We work extensively in Brazil on surveillance of mosquito surveillance to combat dengue, chikungunya, and Zika. We also work in South Africa on a digital TB project. So COVID was just one of our activities where we sprang into operation and quickly launched several projects, kind of recycling or reusing our component-based architecture from projects in our countries. Before I get into COVID, I think it would be good to think about how the healthcare has dramatically changed in the last century and in this century. And the two technological achievements have been revolutionary in terms of changing the way we access and deliver healthcare. One of them is the mobile technology. Obviously, having a device in your pocket, we can all access information and share information about our health is basically one of the first game changers. However, big data and wearable devices, many of you I'm sure are wearing Fitbits or Apple Watches or using any other healthcare or physical activity tracking apps, has really changed the way we collect data and we analyze data. Unfortunately, a lot of this is owned and still run by a lot of big tech and social media companies, and this research, unfortunately, doesn't necessarily allow to access the data. It would be incredibly fruitful and useful for public health needs and services. The other thing which is important, we also realize when we are discussing digital tools and digital interventions, is how media coverage has changed, and how epidemics and pandemics are such a fruitful topic, as you can see from one of my slides, especially for the tabloid and low quality media, which are informing and often misinforming public. Even some presidents, as you can see in South and North America, have been very actively involved in misinforming public. So as public health professionals, it's important we do analyze and understand what's going on in social media and media and try to combat it to improve through evidence-based communication. So before going to COVID, I'm going to kind of move you a decade back to the previous pandemic. And it was swine flu 2009, as you know, which kind of at the end wasn't as severe as was expected from the very beginning. And at the time, it was the early days of social media, and we, I was based at City University at the time, started to look into how social media could be used for early warning for epidemics. And we analyzed data on Twitter in 2009 for about 6 or 7 months from the kind of initial spring peak, and then we managed to also sort of analyze the autumn peak. And we were able to demonstrate that using social media, the signal was strong enough around something of obviously particular public interest that we could predict, in quotes, the upcoming outbreaks about 2 to 3 weeks before the official data from Royal College of GPs and from CDC in the US have been knowing from the traditional reporting systems. So the social media has got a very important role in early warning. Of course, at the time, it was much less critical in terms of noise and bots. So the data were easy to clean than it is these days. However, the potential has been there and it has still never been fully utilized. The other thing we look at the time in this first study was looking at how social media has been used for sharing information, sharing links to important events. And of course, the most important event, however often criticized, was WHO declaration of swine flu as an international concern as a flu pandemics. What we did was look at how this link, this kind of information has been shared, how social media responded. And from this slide, which I have often shared with my colleagues in WHO, CDC, and ECDC, or how unimportant it was to put a press release or information which was officially published by those organizations, and how mainstream media have been actively involved in sharing the information and were much more being retweeted than the official sources. So at the time, as you can see, BBC has been sort of heading the pack much more than CNN and some lower quality US resources, but the official sources, WHO and CDC, were hardly retweeted. Things got a little bit better during COVID because these organizations obviously have been much more closer to public interest and attention, but still sort of working jointly for public communication with the news outlets, especially the higher quality news outlets, is essential. Okay, so having set up the scene, I'm going to move on to COVID and what digital tools have been used and how we can analyze the discourse on social media for purposes of understanding public concerns and response. So I'm going to discuss 3 projects we run in the COVID years. So first of them was called My Lockdown Journal. It was lately renamed to My Activity Journal when lockdown finished. And so we quickly developed a mobile app where people could be reporting their activities, what they were doing, and how they were basically spending their time. Also, that there was a small fee about people who had been journaling their activities. Journaling activities have been demonstrated as being good for well-being and something which improves good mood. In addition to this app being very popular, it was downloaded and used by about 1,200 users in the space of 18 months when we ran it. It was obviously a useful app for people to journal what they were doing every day and being able to go back at things and having a bit more sense of time in the kind of timeless, difficult period. But also it provided us with data. So we have a unique data from those 1,200 users. Some of them use the app on a daily or daily frequencies, reporting what they were actually doing. So what does the app look like? So it just it's got very basic few screens where you can log in and you can choose what you are doing. And there's a little bit of a motivational kind of introduction around sort of well-being and mindfulness. And also people could say if they were enjoying the activity or not by ticking like smiley boxes. They could report whether they were doing the activity on their own or with friends, online or offline. So quite basic. And then there was a small kind of discussion or comment where people could be reflecting on their moods and activities. So in total, we have 11,900 activities reported through the 1,400 registered users. And to make this popular, we also launched a competition on social media, on Instagram and Twitter, where people could be posting pictures and drawings and journals from these lockdown periods. And every week we have chosen one of the drawing. It receives kind of an online visibility as the winner of the week. And also these pictures have been incorporated into the app to give people some inspiration about what other people are doing in lockdown and how they could perhaps, adapt them or implement them in their own families. In addition to reporting, there was some kind of engagement component. So there was an activity tracker. So you could see on the first slide, people could be reflecting in what they're doing, and they could see on each day what they have been reporting through the app. And also they could be winning some badges. And the last one, you can see these are the pictures which people have shared on the social media account through the competition we run, and they are being put into the app to give people the inspiration. So the question we could ask using this data was, well, actually, how people responded to changes in the lockdown and what activities they did, what was the way they spent their time, and also have there been any kind of, could we draw any conclusions about compliance from these activities? So we looked into the stringency of the lockdown, which has been described, and we looked at the days when the stringency has changed, and we monitored kind of the 3 days the stringency changed, the day before and day after, and we specifically analyzed what was happening on the app, what was reported through the app the day before and the day after. So a lot of the activities have been changed. People either wanted to enjoy some last day of freedom before the lockdown or before the stringency got more severe, or the other way around. As soon as things got loosened up, people immediately changed their activities and went out or started doing other things. So you can see, for example, creativity have been one of the things. Other activities, which mostly were kind of personal hobbies, were also quite high up. So in addition to the app we have run for 18 months, we also did a longitudinal 6-phase study called Zoom or Not to Zoom, which started in just after the first lockdown in the UK, so in April 2020, and it was a similar study asking people in a survey way what they're doing, how they're spending their time. And it was run in 6 phases. So you can see on this slide what were the 6 phases until kind of the end of the summer when things got loosened up in 2021. The blue one is kind of illustrating the arrow when things got stricter, and then the yellow when things got a little bit looser. So we could correlate on those 6 phase studies the longitudinal changes in people's activity selection and behavior, and also how positive or negative they felt about it using the PANA score, which was built into it. So it was a different way, much more kind of a coarse grain than the app itself. However, we got quite a high number of people actually following this study throughout the whole period in the 6 phases. So it was interesting to compare the results from the app and from Zoom or Not to Zoom. So one of the interesting outputs, we published about 6 papers on this, so I'm just going to highlight some of the interesting results, and I would welcome you to look up the papers if you're interested to read it in more details. So one of the interesting things was analyzing the PANA score and looking at how the kind of positive reporting, positive activities and the negative activities, how these have been changing throughout the pandemic in those six phases. So obviously, you can see that, like, you know, the positive, the one on the left, the positive PANA score, they have been slightly changing in the phase 3 and 4, which was like the winter of 2020, and then things got a little bit lower on the phase 5, which was the spring 2021. On the negative side, there has been some extremes, but most people were kind of scoring quite low on the negativity, 10 to 20. And again, the kind of high negative increases were again in the phase 5 in the spring 2021. So it kind of showed that people either have been kind of coping well and they were reporting positive scores, or people have been being quite negative throughout, and in those kind of critical phases they were increasingly negative. The majority of our respondees in this study were women kind of over 55, so sort of elderly women. We specifically analyzed this age group, and actually there was a higher degree of correlation with positive reporting of activities in this female age group. On this slide, we also look at how people throughout these 6 phases, how they reported what they did, ranging from culture activities, which obviously at the beginning, culture activities have gone down because everything was closed. Traveling has gone down, of course, because traveling was not possible. However, for example, working and study was still something which was quite high up. People still reported doing it almost daily. And interestingly, getting active has been something which, as you can see on the 5th column, have been also reported being daily or twice or 3 times a week by the majority of population. Also doing interests, which included hobbies and baking, have been scoring quite high up. So yeah, spending time with family and relaxation is not much surprising. So in addition to doing running the app and the competition on Twitter and analyzing kind of the behavior in this six-phase longitudinal study, we also analyzed Twitter, just like we did 10 years ago around swine flu. And on Twitter, we did several studies to kind of understand what public discourse there was. So the biggest study looked at 7 countries. We analyzed sort of multilingual analysis in since April 2020. It was running for, again, 18 months. And we kind of analyzed, we did a topical analysis. So we analyzed what people have been discussing. And we specifically look at responses to official Twitter accounts. So like government accounts, presidents, ministers, public health agencies accounts. So we identify these manually, and then we follow the responses and comments to these accounts. So this was a public response, a public feeling with regards to changes in various policy decisions and the response of the politicians to the crisis. So you can see that the highest one was people being concerned with their leadership, with their leaders, and with their governments. So across all countries, this was the highest discussed topic on Twitter, and also the second highest, especially in the US, was economic concerns. The other thing we did with Twitter was using a sentiment analysis. So again, this slide may not be kind of indicative because it's black and white, but we analyzed the sentiment throughout the period. Obviously, sentiment was quite negative at the beginning in May, June 2020. And there has been a correlation of the sentiment on Twitter with regards to the events in the lockdown. So these kind of little dots above are indicating the changes in the lockdowns, the announcements of new measures, and there was a correlation with public feeling about it. The kind of highest one, as you can see, was around Christmas 2020. So there was still a lot of discussions on Christmas, and people felt a bit more festive and positive. And finally, we analyzed the Twitter data set looking at one specific event. It was the AstraZeneca discussion with regards to link to a blood clot. So we look at this period, like a week before and after, and we look at what has been actually discussed on Twitter. So this is kind of the way we have analyzed the data around the peak of this discussion of this rumor, and you can see that kind of the low credibility tweets which were mentioning some URL which was linking to inaccurate or misinforming information was ranging between 0.2% to 0.4%. So it was a very small number of users were actually sharing this incorrect or inappropriate information. And this slide is just kind of leaving with you which were the sites sharing low credibility information around this kind of discussion on Twitter regarding the AstraZeneca vaccines and blood clot peak in March 2021. So RT.com was obviously leading, and then the Getaway Pundit was the second, etc. But Breitbart, as we I think all know, is a very right-wing and misinforming site. So these all were very active in sharing information about the vaccine being linked to blood clots. Again, this is a paper. If you're interested in detail, you can look at the details in the actual study. So to summarize, we have been fortunate enough, and I'm proud that my center has received the best team of the year for the work during COVID in 2020 by Computing Rising Stars. And we also have received some other awards from various computing and industry awards. So proud of my team. And if you're interested in digital public health specifically, I would draw your attention to the Digital Public Health Conference, which is running right now in Madeira. It's the 10th edition. And also I'm editor-in-chief of Frontier Digital Public Health Journal, and we just launched several interesting research topics around digital public health topics from the conference. So this is just for your attention. Should you be interested, a lot of interesting media coverage of our work. And I'd like to thank to my team for all the hard work during COVID, but also before and after. Without them, these interesting projects would never see the light of the day. So thank you to the DPHE, and thank you for you to listen to me. And I'm open to questions.
and we have time for some questions. And just like I had to be reminded, please speak clearly into the microphone so that Patty can hear you. Okay.
Hi, Patty. I hope you can hear me okay.
Yes.
In your analysis that you did of, I think it was on Twitter, of the blood clot sharing information, and you had it separated by credibility of source, I was just wondering whether you did any further analysis looking at engagement with those social media posts. So kind of how did engagement differ between posts that use credible versus non-credible sources? Because the non-credible sources, it was very small percentage. It was kind of 0.2, 0.4. But my guess is that the engagement overall is higher because of the kind of profiles that would post kind of misinformation.
That's a very interesting question. So in this specific study, we didn't look at engagement in terms of looking at retweets and mention of those low credibility or misinforming posts. However, a lot of work has been done in this field, and research indicates that people are more likely to be sharing misinforming or fake news information than the truth. And also, studies have demonstrated that it is not actually that bots or fake accounts, because they programmed, they are sharing correct and incorrect information in the same way. It's the humans, it's people who actually are more likely to engage in this low quality or misleading information. So your question was absolutely right. But unfortunately, we haven't done this specific follow-up study on this data set.
So while they get the microphone, it's Lorraine here. So Patty, when you look at that data, is there hope for the future? Are there differences between the age groups?
So an interesting question from the Zoom or not to Zoom study, which was UK focused and it was aimed at adults, but partially there was a bias in the respondees. It was more likely, as I mentioned, kind of women over 50 or over 55 who responded to the study. However, we actually analyzed there was a much more resilient attitude reported through the study throughout the pandemics, more positivity reported through the PANAS positive score. So either it shows, that women of this age perhaps didn't have as much financial pressures on them, or may not have been juggling, small children and work like maybe younger women. However, it shows that maybe with age there's some sense of maturity and ability to keep things in kind of a bit of a distance, and the throughout the crisis, and the resilience in this age group was quite remarkably shown.
Thank you.
Thank you, Patty.
The other thing where I think it was interesting to analyze in this multilingual, multi-country study on Twitter was, of course, many people were very unhappy with the government's response, and obviously UK and US have been, and Brazil, have been leading the pack with having obviously leaders who were purposefully misinforming public about the level of the pandemic, the level of the danger. So kind of seeing from the responses of the Twitter how unhappy people were when they were commenting on these leaders and the government responses on Twitter. It was also reassuring that, despite some negative political results in elections we've seen recently, the majority of people who engage in debates on Twitter were still very critical and saw quite clearly how badly their governments have been doing during the crisis. So there is a hope.
Yeah. Thank you, Patty. This is Dallin Bailey from Purbright Institute. It might be a bit of a controversial view, but smartphone access has been one of the sort of great technological success stories. In many countries, especially lower middle income countries, people have got smartphones before they've got other sort of amenities in their houses. I just wondered whether or not what you feel like the international picture for this story, especially in lower middle income countries, in terms of engagement.
Yeah. So we did We look into 10 languages when we were looking at on the social media study, but some of the languages were just so so insignificantly in terms of the comparison of the data set. So we only focus on the 7 languages I reported.
Sorry, Patty, we lost you for a minute. Could you repeat your answer, please?
No worries, no worries. So I was just saying, we initially started to be looking at 10 languages in the social media study during Twitter, but some of the languages just we didn't collect enough tweets. So we, for comparative reasons, we have sort of focused on analyzing only 7 languages. And the engagement was, yeah, in terms of the size of the data set was comparative. I think going more into your questions around the engagement and the ability of phones in low-income settings, I think this is absolutely true. You know, one of my projects, which I didn't discuss today, is work in Nepal, one of the lowest income country, and in Nepal there is, I think, now 1.8 mobile phones per capita. Obviously, not many people have phones in there, so some people have 2. But even in a country like Nepal, we have been able to do an exciting sort of mobile phone game for rural women who have seen the mobile phone sometimes first time in their life, but could very quickly engage with the technology and learn from it. So I definitely would have hope, and that's one of the reasons I enjoy working in low-income countries, because the technology is bringing people better health and better knowledge in a very affordable way, regardless of how far from the healthcare sources they are.
Yeah, David.
Thanks, Patty. This is David Bauer from the CRIC. I was very curious about the plots you showed for the 2009 swine flu pandemic and about how people were reposting BBC, CNN, and so on. Have you ever done a direct head-to-head comparison about sort of how the tables have turned? Because of course, Twitter in 2009, I would imagine people are often tweeting what the BBC has reported. And if I think about the pandemic and about today, the BBC is often reporting what someone said on Twitter. It's the complete opposite way around. So how does that shift look? Can you quantify that? And can you see the impact on credible versus non-credible information or even people's behaviors?
That's super interesting question, and I wouldn't have the answer for. So just going back to 2009, definitely it was the early days of Twitter. Twitter was at the time used by young people, geeks. You have no politicians, you have no companies on Twitter, and you have no fake accounts, no trolls. At the time, you have to retweet by copying the tweet yourself and put RT in front of it by hand, right? Because the interface was so basic at the time. So those were the days. The good thing was that at the time, the cleaning was really easy because people basically have been just genuinely sharing what they did today and who they met. And it was kind of a quite exciting, honest, I would say, debate. Unlikely now when you're analyzing the COVID data set, when basically there's so much mess and so much inaccurate information. And now it's got even worse, obviously, on Twitter, since it was purchased by Elon Musk and it's now X. Not just he closed the API, so the way that Twitter was searched by all these studies was a free access to the online search engine, which he closed, so it's no longer available for researchers to do free research. And also, obviously, it's so polarized that I think analyzing anything, even for the paid version, will be meaningless on X. In terms of getting some realistic picture of what people really think. So in terms of your question, whether it would be the data how would the data stack up in terms of the media reporting, social media that nowadays, as opposed to in the past, social media reporting what BBC said or WHO said. Absolutely, I think that the social media definitely took over the way our news, our information is being shared in the kind of cyberspace, and that's why it's super important for public health professionals not to kind of shy away from there and be much more active in kind of spreading quality information, public communication, evidence-based stuff through the social media space than it was in the past, where people still rely much more on the traditional media. having exact figures how these graphs would look like nowadays, and in kind of BBC and other media sharing social media, I wouldn't have the figures. We haven't done this study, and I haven't seen it anywhere else being done in a similar comparative way, but it would be interesting.
Hi, Patty. Great talk. This is Aya Donovan Banfield from the University of Liverpool. It kind of follows on from the answer you've just given at the end there. Have you compared the actual type of content that is contained in these social media messages and whether that influences whether someone shares it? Because I guess there's part of the issue is that people mistrust different forms of media now. So people would rather trust someone who, their auntie on Facebook sharing a bit of information than the BBC. And how can we cope with that in how we design our materials for scientific communication to kind of help reach community harder to reach generally?
Interesting question. Absolutely. So we did a different study which I didn't share today, analyzing the kind of movement of the information through the social media space. And it was looking at the HPV debate around 2014-15, when there was all these controversies about the women fainting, and there was all these anti-vaccine kind of groups being very active on Twitter at the time. So we analyzed Twitter, and we looked at how the information travels. So who is actually retweeting it or mentioning it, and what is the size of the audience they reach out. So what is the size of their followers who get exposed to this information being retweeted by person X. So because this is in a way the most effective way would be analyzing who are the people who are most effective in reaching out to the largest number of people in order to attract them or get the accounts closed if they are continuously misleading the information. So in this HPV study, we identified there was a lot of response to and sharing of this sort of fainting issue, which was mostly coming from a professional anti-vax accounts, sharing quick videos or links to their own websites, which were unfortunately retweeted. However, we also found that one of the American A-list actor Jim Carrey has been also retweeting these anti-vax messages, and because his media outreach was I don't know how many million users at a time, he immediately got massive kind of share of the sharing and engagement of this information. So sometimes it's not essential to just identify the source or try to discredit or close down the source account. It's also important to know who has got the biggest kind of share, who can create harm like this if the information is shared. Or if we work with some celebrities who are happy to be sharing information on behalf of public health experts or governments sharing it correctly, then this obviously will have the positive effect. So I think kind of using the influences in a positive way would have a potentially a critical impact on public, especially young people.
Thank you.
Thank you. Hi, Patty. Thanks. That was really interesting. I'm Fiona Lethbridge from the Science Media Centre, so a bit of an interloper here today. But I just wanted to ask you a bit more, if you could say a little bit more about, you talked about the misinformation around the AstraZeneca vaccine blood clots, and you showed that really interesting graph with certain outlets, including Breitbart. But of course, we also know that there was a real side effect, adverse event associated with vaccine of blood clots as well. So, and we also know that all of the media sources in the UK, including the BBC and the Times and the Guardian, of course, they reported on the blood clot risk from that vaccine because it was real and it was also on the NHS and it's what JCVI were telling us and that sort of thing. So I'm interested in how, but of course they did it responsibly and they talked about the tiny size of the tiny proportion of occurrence of the side effect, and that in most groups the benefits outweigh the risks, etc., etc. So they did it responsibly. So how do you categorize whether something was misinformation or accurate information when it's talking about the blood clot side effect of the vaccine?
Yeah, very, very good question. And So this is one of the critical questions. How do you actually differentiate what is true or what is correct? So in this specific study, we have looked at websites which were previously, by previous studies, categorized as repeatedly sharing incorrect or fake information around any subjects. And these websites were categorized by, I think, 6 independent members of the audience, and they have got like over 95% agreement that these websites are considered sort of low credibility information websites. So these were the URLs we specifically looked for being shared through the Twitter dataset around the blood clot information. So the information itself was incorrect. So of course, for this reason, like the Guardian or other sort of responsible media discussing this issue were not in our sort of categorized data set. However, I think you're absolutely right. There could be ways when the information, there's a gray space between what something is correct and is not correctly shared. So how do we work through the gray space, and whether we would be encouraged to respond to people who are not sharing something because of issues with inaccuracy, or whether there is a purposeful misleading. I think this is a space which has not been done well on the social media, and this is, I think, what creates one of the most exciting opportunity going forward. How do we work with people who are sharing something which is not quite inaccurate but not correct?
Hiya, that was a great talk. Thank you so much. It's Charlotte Parker from the University of Nottingham. And I have a question about your app and how much information you collected about the users of your app. So you've mentioned that there were typically more female and over the age of 55, but I wondered if you collected any socioeconomic information on your users, what jobs they were doing, if they had families, where they lived, if they had relatives. I think that's all really critical information to building up what people's lockdown experience was like. So yeah, and also secondary to that, how much do you trust what people were telling you on the app? If people had gone to the pub with their mates, they might put that down as weeding the gut. Like how much what people do.
Good question. So just to differentiate, there were 2 studies. So the Zoom or not to Zoom was an online survey we ran in those kind of 6 stages. And this study, because it was a survey at the time, people were happy to be responding to surveys because they were in lockdown. We did ask a number of kind of information around their socioeconomic background and where they lived. So we got pretty much good sort of geographical coverage of the UK. We got few people from overseas, but these were discarded because we focused on a UK population. And you're absolutely right. Not just the elderly women were more resilient and more positive throughout the period. Also, many of them were kind of middle class people, and also they had a garden. We also asked about the outside space access. So, of course, it is much easier to be in your own garden during lockdown if you are a middle class person than if you are someone living in a council estate and has got 5 kids. So, so in this study we would have identified a correlation of the people with socioeconomic deprivation, regardless of the geographic distribution across the UK. On the app, it wasn't 65 plus women. It was quite all age groups were using the app. Surprisingly, one of our most loyal users were actually women who were like I think over 60, so someone who you would not associate with being an active, ongoing user of a kind of journaling app. We get lots of young people, both genders. So I think, or other genders. So I think the app was not specifically for the older age group. In terms of your questions on how we can trust the information, well, people use the app as a device because they want it. They downloaded it. They obviously agreed with the data being used for research purposes, but they didn't. I don't think they realized that the information actually would be able to determine what was the compliance with the lockdown. They just used it because they were recording their activities. They like looking back at what they did last week, etc. So I think the app could be trusted with this regards, because there was no need for them to be lying on the app. But you know, and again, this is not something we can prove.
Thank you very much, everyone. That's all the time we have for questions. Please join me in thanking Patty.
So thanks everyone, and thanks to all the speakers for keeping to time. I've been asked to let you know that dinner is being served just outside the doors. So hope you enjoy and partake. So, but thanks again, everyone.